So, good day everyone. Today, I'll present Ida Jean Orlando's deliberative nursing process theory. So, now, let's talk about Ida Jean Orlando. She was born in 1926 and was actually a first-generation Irish-American. For her education, she earned her nursing diploma at St. John's University in New York, and later on, she completed her master's degree in mental health nursing at Columbia University. Basta tandaan nyo lang, yung nursing diploma niya is nakuha niya sa St. John's University in New York. Then, yung master's in mental health nursing niya is sa Columbia University. Okay. Also, she had remarkable career in nursing education and research, particularly in psychiatric and mental health nursing. One of Orlando's biggest contributions was through her publications. So, yung una niyang theory is nag-appear sa kanyang book entitled The Dynamic Nurse-Patient Relationship in 1961. Later on, she also published The Discipline and Teaching of Nursing Processes in 1972. So, bali dalawa yun, yung The Dynamic Nurse-Patient Relationship noong 1961 and The Discipline and Teaching of Nursing Processes noong 1972. Now, let's talk about the theory itself. It is based on how nurses interact with patients. So yes, yung theory ni Orlando is na-develop niya base sa kanyang observation kung paano makipag-interact yung nurses at patients. For example, kung uhaw yung pasyente mo, hindi mo pwedeng ipagpaliban yun. Dapat bigyan agad ng tubig para guminawa ang kanyang pakiramdam. Now, let's move on to her contributions and personal life. Orlando's main focus was really on the nurse-patient relationship. Nurse-patient relationship. Yan. She emphasized that nursing actions should always be deliberate, not just automatic. She also pushed for the idea that nurses should respond based on the patient's immediate needs and behavior. This became a guide for better patient care. In her personal life, Orlando was married to Robert Pelletier, and she lived in the Boston area. Another key point is the organizing principle of her theory. Nurses must always focus on what the patient needs right now. Help can be direct, like giving medicine, or indirect, like calling the doctor. For example, kung ang pasyente ay nagsabi, "Nurse, ang sakit ng ulo ko," hindi pwedeng ipagwalang bahala yun. Pwedeng bigyan mo siya ng gamot, or kaya tawagin mo yung doctor kung kinakailangan. Now, let's talk about problematic solution. I will read it first before giving an example. The patient's presenting behavior, problematic situation. The nurse must first see that something is wrong, a problem. The way the patient acts or talks could be cry for help. Nurses and patients must work together to find the real problem and the right solution. The nurse-patient meeting is like a team. What one does affects the other. The patient's behavior makes the nurse react, and that reaction is the starting point to figure out what's really happening. So yeah, basically, sinasabi niya dito is, behavior often shows hidden needs. So, for example, kapag umiiyak yung pasyente mo, hindi agad ibig sabihin nun is malungkot siya. Baka naman may masakit na bahagi ng katawan niya. Kaya naman dapat tanungin muna natin ito. Tulad ng, may masakit po ba sa inyo? O kaya may iniisip po ba kayo? Ganon. Internal response. So in short, internal response is the nurse's quick reaction when a patient shows a problem like crying or looking pale. It happens in 3 steps. 1. The nurse sees or hears something. 2. Thinks about it. 3. Feels something, then acts. Example, kung biglang mubo ang pasyente, maiisip ng nurse na baka may problema sa paghinga or what, kaya agad niya itong lalapitan. In any person's process of action, 4 distinct items occur sequentially. So yeah, there are 4 steps: perception, thought, feelings, then action. The first 3 happen inside. and only the action can be seen. Ayan, halimbawa ulit, nakita ng nurse na namumutla ang pasyente. Naisip nito na baka nahihilo, nakaramdam ng urgency at agad sinungkat ang vital signs. So yun, every nurse may react differently. Pwedeng tama o mali ang interpretation. Pero lahat ng reaksyon ng nurse at data ng pasyente ay mahalaga para malaman ang totoong problema. Next, we will look at reflective inquiry. In short, reflective inquiry means the nurse and patient affect each other. The nurse doesn't guess the patient's needs. Instead, they listens, watches, and asks to understand. For example, if the patient is crying, the nurse can ask, "Are you really feeling this way? Do you need help?" Then the nurse checks if her understanding is correct. This way, both nurse and patient communicate clearly, preventing mistakes. So, ang goal dito is, the patient feels better, understood, and less helpless. This slide shows the resolution phase. It is when the nurse checks if the care really helped. Example, kung binigyan ng gamot ang pasyente at bumaba ang lagnat, ibig sabihin natugunan ang pangangailangan niya. Pangangailangan ng pasyente. Now, let's talk about the assumptions of her theory. Patients may feel helpless. The nurse-patient relationship is two-way. The nursing focuses on unmet needs. This shows nursing is both caring and teamwork. Example, kung hindi makabangon ng pasyente para pumunta sa banyo, nararamdaman niyang helpless siya. Dito pumapasok ang nurse para tulungan siya or tumulong sa pasyente. So now let's move on to assessing a patient using Orlando's theory. The first one is guiding principle. The nurse's main job is to find out what the patient really needs, and the focus is always on the patient. The first one is guiding principle. The nurse's main job is to find out what the patient really needs, and the focus is always on the patient. Halimbawa, kung may pasyente na hindi kumakain, hindi agad iniisip ng nurse na matigas ang ulo niya. Instead, tatanungin niya yung patient, may masakit po ba sa inyo or wala lang po kayong ganang kumain? Ganun. So yes, dun pumapasok yung trabaho ng nurse na hanapin kung ano yung kinakailangan ng pasyente. So the next one is problematic situation and immediate reaction. The nurse observes signs that something is wrong and reacts based on their thoughts and observations. For example, kung umiiyak ang pasyente habang ini-injectionan, maiisip ng nurse na baka natatakot ito or nasasaktan, kaya ganun. The third one is inquiry or problem determination. The nurse talks with the patient to confirm the real problem and make sure the understanding is correct. For example, kung sinabi ng pasyente na masakit ang tiyan, tatanungin ng nurse, dito po ba sa kanan? Basta dito sa problem determination, hanapin talaga nila yung totoong problema. The fourth one is planning actions. The nurse and patient decide together what needs to be done. If they disagree, they talk it out until they agree. For example, ayaw ng pasyente na inumin agad ang gamot kasi baka sumakit yung tiyan niya, ganon, kasi hindi naman siya sanay uminom. So, ipapaliwanag ng nurse yun kung bakit kailangan niya uminom ng gamot hanggang maintindihan na ng pasyente. Tapos, iinom na siya ng gamot. The fifth one is implementation. If the patient can do it on their own, the nurse assists and check if it works. So, yan. Halimbawa, kung hindi makabangon ng pasyente natin para uminom ng tubig, tayong mga nurse, tutulungan ito at babantayan upang makita kung gumaan ang kanilang pakiramdam. And finally, improvement resolution. The nurse checks if the patient feels better. If yes, the action worked. If not, the nurse continues exploring until there's improvement. Ang example dito is, kung matapos uminom ng gamot ang pasyente natin, tapos sinabi nilang, mas gumaan po ang aking pakiramdam, ganun. Ibig sabihin, effective ang ginawa. So, ayun. This shows that Orlando's theory highlights listening, talking with the patient, and making sure that the help truly works. The next slide is methodology of Orlando's theory. So we have here the four meta paradigms: person, environment, health, nursing. So person, every patient is a growing human being with needs. Some patients can take care of themselves or follow medical treatment alone. And the second one is environment. It is not specifically defined, but it refers to whatever surrounds the patient at the particular moment. Health. This means the patient should feel okay, comfortable, and have their needs properly met. And lastly, nursing. The nurse works closely with the patient, especially helping those who feel helpless. Next, let's look at the goal of nursing. The main goal is to make the patient feel better, help them take care of themselves, and improve their behavior. Now, how nurses work or their therapeutic functions. First is the direct function, where nurses help patients explain what they feel and what they need. Second is the indirect function, where nurses ask others for help if needed. And the third, we have discipline and professional activities. This combines automatic responses with careful thinking, matching actions with the right words and feelings. And lastly, automatic activities, which include using the senses, automatic thoughts, feelings, and actions. So, ayan, in short, Orlando's theory emphasizes truly seeing the patient, understanding what they need, helping them directly, and making sure they actually feel better. And finally, let's talk about the conclusion. Nursing is a dynamic two-way relationship. It focuses on immediate needs. The goal is to relieve distress and improve comfort. So, in short, Orlando's theory tells us that nurses must not guess, but instead deliberately act based on what the patient really needs. Sa madaling salita, huwag manghula. Tanungin at tulungan ang pasyente para gumana ang pakiramdam niya. Ayun po yung theory ni Ida Jean Orlando. Thank you for listening. At this point, let's proceed to the case scenario shown in the video.
This is Loida. She is in the hospital because she feels sick and dizzy. According to Orlando's theory, Loida's behavior, like asking for help or looking worried, is a clue that she has needs. The nurse's job is to find out what Loida needs right now and help her feel better. First, the nurse watches Loida carefully. She notices clues like Loida holding her head, looking worried, or frustrated with something. These are called presenting behaviors.
Hi Loida, I'm Nurse Kim. Napansin ko na hawak mong ulo mo at mukhang worried ka. Can you tell me something? What's bothering you?
I feel dizzy and parang umiikot yung paligid. I'm scared baka mahulog or mahimatay.
Okay, ganito na lang. Let's make sure na you're safe first. Tutulungan kita tumandal para makapag-relax ka. Okay lang ba sa'yo?
Sure.
When did you start feeling dizzy? May kinain ka ba or any medicine you took before it happened?
Hindi po kasi ako nag-breakfast and bigla na lang ako nahulog.
I see. Thank you for telling me. It helps me understand what's going on. Hintayin mo ako dito at kukuha lang ako ng food mo.
Sige po.
Hi Loida, I'll give you some water and food and we'll call the doctor if needed. Okay ba yung plan sa'yo?
Sige po. Thank you.
How do you feel right now after eating and drinking water?
Mas okay na po and unti-unti na din po nawawala yung pagka-feel. Thank you po.
Oh, I'm glad to hear that. Don't worry, I'll keep checking on you.
Thank you po.
In Orlando's theory, nursing is about noticing needs and acting fast to help, not just following orders. Every patient is unique and nurses learn the best way to help by asking, watching, and responding. In Orlando's theory, we see the four meta paradigms. The person is Loida, a human being with immediate needs. Health is feeling safe, relieved, and supported. Nursing is Nurse Kim noticing, asking, and acting to help Loida. And the environment is the hospital room and everything around it affects Loida's well-being.
Good morning, I am Resultay. Today, I'm going to present to you what is self-care deficit theory by the Orem. So let's start. Before we proceed, what is self-care deficit theory is, let's begin. Who is Dorothea Orem? Orem is one of the notable nurses in nursing history. Orem is America's foremost nursing theorist. Was born in Baltimore, Maryland in 1914. She earned the Bachelor of Science in Nursing in 1939 and Master of Science in Nursing in 1945. During her professional career, she worked a lot in different aspects of being a nurse. She became a staff nurse, private duty nurse, nurse educator, and administrator, and nurse consultant. Kung mapapansin natin dito, Orem hindi lang siya nagtrabaho sa hospital, pero nagtrabaho rin siya when it comes to educational field. Orem also received a lot of doctor degrees. Doctor of Science degree in 1976, and after that, nagkaroon siya ng maraming doctorate title. Orem is a member of curriculum subcommittee of one of the Catholic University. She also recognized to continue developing a conceptualization of nursing. Nung pinasok niya yung mundo ng educational field aligned with her profession being a nurse, dito na siya nagkaroon ng maraming conceptualization para sa nursing. One of his first formal articulation of her ideas, entitled Nursing Concept of Practice in 1971, and later on, she published in 1980 and finally in 1995. Orem developed the self-care deficit nursing theory, or also known as SDNT, and because of that, she received many awards during her distinguished career in nursing. Many papers and presentations provide insight into her views on nursing practice, nursing education, and nursing science. As well as I said a while ago, Orem did not only work as a full-time nurse, but she also worked on educational curriculum field. And later on, Orem died in June 22, 2007 at the age of 92. And this is the major concept or definition of self-care deficit theory by Orem. Sinabi ni Orem that nursing is both a science and art. Nurses use their knowledge and experience is the science to make a good care plans and then give care in kind and helpful ways. That's art. Yung knowledge that they obtain from the experience, that's science. And giving the care to our needed patient is in a form of art. And nurses use two kinds of knowledge. According to Orem, nurses in this theory, they use two knowledge. We have the empirical knowledge. This knowledge is learning from real experiences, watching what happens, and choosing the right actions. Ibig sabihin lang po nito, pag sinabi natin empirical knowledge, this is our mga experiences, personal experiences. At yung binibase natin kung anong mang nangyayari. At doon pa lang, nakikita natin kung ano yung right action natin pag in-apply natin sa sarili natin. That is empirical knowledge. You guys basing on real experiences, real happenings. But the antecedent knowledge, it uses the lessons from the past, what is already known from people, health, and situation. Again, this is the past lessons already known about people, health, and situation, and we guys applying it on real life scenario. Okay, i-recap ulit natin. Pag sinabi natin empirical knowledge, this is the real experiences. Or ito yung mga learnings na makikita natin sa ngayon, watching what happens, and choosing the right actions. Ibig sabihin, nangyayari siya ngayon. Those are real experiences, pwedeng sa'yo at sa iba. And you guys apply it. Pero pag antecedent knowledge naman, meron kasi ditong in-emphasize niya, these are the past lessons. Meaning, nagawa na ng iba. And we guys applying it, which is already known about the people, health, and situation. Those are the three marks na nag-a-apply if ay nag-emphasize when it comes to antecedent knowledge. These three, people, health, and situation. This means nurses think, plan, and act to help people when they cannot take care of themselves. Pumapasok na rito yung sinasabi natin self-care. Pag sinabi kasi natin self-care, what is the concept of self-care? Sabihin natin, ano nga ba yung self-care kung titingnan natin in a simple definition. Pag sinabi kasi natin self-care, this is what people do for themselves. Ibig sabihin, yung isang tao, paano niya inaalagaan yung sarili niya. Self-care. Example of this is eating, doing their personal hygienes, and sleeping. Again, these people do by themselves. Like what I said kanina, like eating, sleeping, drinking water, and keeping clean. Dito na pumapasok yung mga basic needs things na kailangan as a person. Ito na yung mga dapat mong gawin kasi this is your personal Kasi when it comes to self-care, ito yung mga basic personal care plans na ginagawa mo sa sarili mo. Pero pag self-care agency naman, the concept of self-care agency is a person's ability to care for themselves. Pero, they're independent. This is only mayroon siyang basihan. Ibig sabihin, may range to. It can be depends on age, family, culture, and what resources they have. Ibig sabihin, self-care agency, meron ng nakadepende. Maalagaan lang nila yung sarili nila. Depende sa age, health, family, culture, and especially the resources they have. Okay, magbigay tayo ng scenario. A 70-year-old man with arthritis struggles to button his shirt, showing reduced self-care agency compared to a younger adult, diba? O yung 70 years old, sabi niya, may pupuntahan ako, ganun. Tapos, he's having a hard time to button his shirt. Pero if you're going to compare to a young adult, they easily button their shirt, right? Ibig sabihin, there is a reducing of self-care agency. Kasi nakaka-apekto yung pagka-self-care nila sa sarili nila because on age, health, family, culture, and resources they have. Again, self-care agency yun nagkakaroon ng reducing of self-care agency nakadepende on age, health, family, culture, and what resources they have. Next, we have the therapeutic self-care demand. When we say therapeutic self-care demand, all the care a person needs at a given time. Ibig sabihin, meron lang specific, kunyari, may specific time na kailangan niyang, may help siya na kailangan niya lang in a specific time. And dapat ma-meet yun agad-agad. And sabihin natin, for example, is after surgery, Anna needs rest, pain management, wound cleaning, proper nutrition, and walking assistance. Ibig sabihin, i-apply lang natin yung mga care na yun or ibibigay natin kay Anna after the surgery. Hindi mo naman kasi pwedeng ibigay yun kay Anna yung pagbibigay ng pain management, wound cleaning, proper nutrition before the surgery, di ba? Siyempre, hindi pa siya inuoperahan. Ayun lang yun. Pag sinabi natin therapeutic self-care theory, there is a specific time yung pagbibigay mo ng help. Ibig sabihin, meron lang nandoon may specific time lang. And we have self-care requisites. The self-care requisite, there are types of needs under self-care. We have the universal, developmental, and health division. Sa universal needs naman, this is our everyday things. Ano ba yung mga everyday things natin? This is also known as the basic needs of everyone, of every individual human. Everyday things like breathing, eating, drinking, resting, staying safe, and balancing alone time with social time. Diba sa universal needs, nakikita nyo dyan is na-meet nyo yung holistic health, not only in physiological, not only in self-esteem, but also lahat, including the social aspect. Developmental needs, changes in life like growing up, pregnancy, or adjusting to new jobs or aging. Ito naman sa developmental needs, from the word self, developmental, may nagkakaroon ng something improve, something changes. It's because of life stages. Ito yung mga needs that change with life stages. Example of this is a pregnant woman goes to prenatal check-ups to support her babies develop. Ibig sabihin, nung hindi pa siya pregnant, hindi niya yun ginagawa. Pero, nung nagkaroon ng changes of life stages niya, being a pregnant mother, is nagkaroon na ng check-up. Diba? Nakita niyo yung difference between the two. Na nagkakaroon tayo ng different needs according to our stages. Siyempre, pag pregnant ka, what are the things or what are the practices that you need to do, di ba? One of this is magpa-check up. stay healthy. Bakit ginagawa mo ba yung magpa-check up sa sa doctor about your babies nung hindi ka pa buntis? Diba hindi? Ibig sabihin lang doon, nagkakaroon ng new practices pag nagkaroon ka ng new changes sa katawan mo. That is developmental needs. Health and division needs, this is the needs when sick or injured. When someone is sick or hurt, like taking medicine, going to the doctor, or learning how to live with a disease. Ito na yung ginagawa natin. Ito yung madalas na ginagawa talaga. Or hindi madalas, ito talaga yung needs ng someone is, involved yung health nila. Health division needs ang tawag doon. Example of this is a diabetic patient takes insulin injection regularly to manage blood sugar. Kung sa developmental needs naman, yung life stages. Pero sa health division needs naman is, nagkaroon ka ng, involved na rito yung sakit. Meaning, meron kang iniinda sa katawan mo. Especially dito kasi sa physical, ang health dito. Ang mostly, hindi kami sinasabing lahat, mostly sa health division needs, ang may kinalaman dito, gamit ito when it comes to physical sickness. Example ngayon, a diabetic patient takes insulin injection regularly to manage blood sugar, diba? In order to maintain the patient, regular number of blood sugar, nagtitake siya ng insulin injections, diba? That is need niya for his or her health. Pag universal health, again, universal health, these are the basic needs. Pag developmental needs naman, this is the changes with life stages. Siyempre, pag sa developmental kasi, pag may nagbago sa sarili mo, may kailangan ka ring baguhin sa habits mo, sa mga practices mo, sa daily routine mo. Pero pag health division needs naman, pinag-uusapan natin dito yung kalusugan. And mostly, ang health dito, ang health division need is mostly nakapaloob sa physical sickness. Next is theory of dependent care. Dependent care naman says that he care given to someone who cannot do self-care on their own. Example of this is a mom feeding her baby or a nurse helping an elderly patient to take medicine. Sa dependent care naman, the patient has no ability to take care his or herself. Meaning, hindi niya kayang alagaan yung sarili niya on his or her own. Kailangan nila ng given to someone who cannot self-care. Ayun nga, a mother feeds and changes diaper to her newborn baby. A mom feeding her baby. A nurse helping an elderly patient to take medicine, di ba? They need care because they can't provide sa sarili nila mismo. Ay lang dependent. Nagiging dependent sila sa isang tao. Like, example of this, yung tao na yun is nurses. Nagiging dependent sila sa ating mga medical workers, especially if we're going to apply in our program, nursing, mga nurse. Kasi they are not capable to take care of their own. Diba? Kaya they need someone's care. That is dependent care. Pero pag sinabi naman natin dependent care agency, the concept is caregiver's ability to provide needed care. This is the ability to the caregiver, like a parent, family member, or a nurse, to know what the dependent person needs and to actually provide that care. Sa dependent care agency naman, ito na yung someone na tumulong or tutulong dun sa dependent care. Sa dependent care ay yung patient. Sa dependent care agency, siya yung tutulong kay patient na sa dependent care. Gets, no? Sa dependent care, it can be a parent, a family member, or syempre tayong mga future nurses. Ang tawag sa atin is mga dependent care agency. We are the one who give a person needs to provide the care that they need. Kuha? Pero pag dependent care deficit naman, the concept is when the caregiver cannot meet all of the dependent person's needs. Again, this happen when the caregiver cannot fully meet the needs of dependent person. For example, if the grandmother is caring for a sick child but doesn't know how to give the right medicine, that's a deficit. Ibig sabihin, ito na yung something na yung care agency or the caregiver cannot provide the needs or the needs that the dependent care need. Ibig sabihin, pwede rin kasi ditong they are limitation of knowledge, ganun. Ang tawag dun sa mga ganun. Ibig sabihin, pag hindi kaya pag nagkakaroon ng deficit kasi, hindi natin mamimit yung kailangan ni dependent care or yung patient na nangangailangan ng tulong. Sabi ni Orem dito na may mga ganong kaso daw. Kaya, pag nagkakaroon ng dependent care deficit, kailangan ng new dependent care agency to meet the needs. Kasi, kunyari, imagine natin dito, yung grandmother, di ba? Hindi niya alam yung right medicine. E di, alangan na magbibigay siya ng something na medicine na hindi niya alam, di ba? Anong usually ginagawa ng mga ganon pag may mga nagbabantay sa hospital? They tend to, the possible ways that they're going to do is, first is, magtatanong sila. Magtatanong saan? Sa mga health health workers doon sa hospital. Or second, ipapaubayan nila yung gagawin. And do you think that's okay? Yes, it's okay. Kasi, alangan na isusugal mo yung lack of or limitation of knowledge, sabihin na lang natin sa isang tao, kasi ang pinag-uusapan dito is patient di ba? And that's okay. It's okay to ask for help as a dependent care agency. Ito yung mga ano lang to pero nangyayari rin sa mga nurses, like something na may mga unexpected events, ganon, that na maybe they are not sure, ganon, they tend to ask for their co-workers, and that's okay. Pero ang tawag doon sa pag ganong scenario sa hospital is what we call dependent care deficit. Ito na yung pagkakaroon ng hindi pagbibigay ng needs doon sa dependent person. Dependent care demand is what we call the care actions that must be done for the dependent person at a certain time. For example, a newborn baby demand is feeding, bathing, sleeping, keeping warm, and getting medical checkups. Ito naman sa dependent care demand, ito yung mga action that must be done on the dependent person at may sagradong oras lang. Ibig sabihin, there is a certain time to meet their needs sa ganong oras lang, sa ganong panahon lang. Kasi nga, doon lang nila kailangan. Diba? Ano nga na ibibigay mo nung hindi nila kailangan? Example nga dito is a newborn baby demand. A newborn baby, syempre, what are the needs of newborn baby? They need feeding, bathing, sleeping, keeping warm, and getting medical checkups. Yung mga yun, hindi kaya ng baby. Kaya, diba, ibibigay mo lang naman yung feeding, bathing, sleeping, keeping warm, and getting medical checkups sa isang baby, and you can't do that sa mga adult na, diba? There's a certain time lang. Dependent care, okay, summary of this is care given to someone who can't care for themselves, like babies, elderly, or sick people. Ito yung mga yon. Dependent care agency, this is the caregivers, the one who helping. Ito yung may kunwari na hospital, si ganito, ganyan. Sino man nagbabantay, ganon. Si dependent care agency yon. Ability to provide needed care. Kasi, hindi naman, diba, sa hospital setting, hindi naman palaging nandoon yung mga nurses. Nagkakaroon lang sila ng scheduled time to visit. Pero nurses, as a future nurses, we are one of the example of dependent care agency because we're the one who giving needs care sa dependent care. Dependent care deficit, this happens when the caregiver's ability is not enough to meet the person's need. Ibig sabihin, hindi niya mabigay yung need ng isang, hindi niya mabigay yung person. It's because of ability, they're not capable enough. Ganun lang yan. But it's okay. If your guys not capable enough. Kasi, sabihan nila sa nurses, if unsure, discard. Dependent care deficit, yun. It's okay to ask. Kunwari sa mga family, kasi, I can't deny, talagang nangyari ito sa real life scenario na, pag hindi alam, especially sa mga family members, if they don't know something or some, na ilalagay dun sa patient, they tend to ask naman, di ba? And that's okay. Pero ang tawag doon sa pagkakaroon ng lack of ability nila or lack of capableness nila is self-care deficit. Yung concept yung tignan natin. Dependent care demand, the total amount of care needed for the dependent person at a given time. Ito naman sa dependent care demand, nagkakaroon siya ng demanding of care on a specific time. Ganun lang. Next is theory of self-care deficit. Ito na yun. Self-care deficit happens when a person needs or the demand of the person are bigger than what they can do for themselves or agency. This is the point where nurses are needed. Nursing care is required when a person or caregiver like a parent cannot enough self-care. Orem's 5 ways nurses can help is, first one is doing things for the person. Second, guiding the person. Third, supporting the person. Fourth, creating a healthy environment. 5, teaching the person. Oh my gosh, nag-back. Nurses mix and match. these methods depending on what the patient needs. In short, if someone can't take care of themselves, nurses step in and help in different ways to keep them healthy. Ang tatandaan nyo lang sa self-care deficit, theory of self-care deficit, from the word itself, deficit, yung self-care ng isang patient, they can, ito na lang, yung pag-aalaga ng isang tao sa sarili niya, they are not capable enough. Maybe because they are sick. Yes, they are sick. The patient or the person is sick because they can't give the needs or care for themselves. Ngayon, nagkakaroon ng, syempre, if hindi kaya, para sa agarang lunas, is nagkakaroon ng pag-step ng mga health workers, especially the nurses. And nurses, according to Orem, can help in 5 ways. It's like what we mentioned kanina, that's doing things for the person, guiding the person, supporting the person, creating a healthy environment, and teaching the person. And sabi din ni Orem, pwede itong gawin ng mga nurses according sa need ng patient. Ibig sabihin lang ng self-care deficit, if someone can take care of themselves, nurses step and help in different ways to keep them healthy. Pag hindi nila kayang tulungan yung sarili nila, this is the perfect time that nurses gonna help in different ways. Hindi lang sa physical, bagkus pwede rin sa mental, yung sa environment nila, gagay nila yung person, ika-counsel nila yung person, ganun. Example of this, sabihin na lang natin yung yung isang patient is after surgery niya, sabihin natin ganun. And after surgery, syempre, they don't have the ability to take care of themselves, especially yung mga basic needs nila na kailangan gawin, di ba? Yung pagkain, ganun, pag kumain, maligo, mag-walk, ganun, they don't have the ability pa nun kasi nga nanghihina sila because after of surgery. Ngayon doon napapasok yung mga ang tawag doon sa pag-reduce ng ability nila to take care of themselves is self-care deficit. Ngayon, pag nagkakaroon ng self-care deficit sa isang patient, doon na nag-step up ang mga nurses. Ayun ang tatandaan nyo. And nurses ay hindi lang sila tumutulong sa physical needs ng isang tao, but because they can help in a holistic way. They should provide the needs of a patient in a holistic way. Next is theory of nursing system. Nursing system are the ways nurses help patients meet their self-care needs depending on how much the patient can do. There are 3 types of nursing system. The first one is wholly compensatory. Nurse does everything. The patient cannot care for themselves at all, diba? The nurse does everything for all the patient, like feeding, bathing, moving, and giving medicine. Example of this is a patient who is unconscious after a stroke or a person with paralysis. Sa wholly compensatory naman, ang binibigay ng, tanda nyo lang ito, ang binibigay ng nurse is lahat, binigay niya lahat, including the basic needs. Kasi diba, if a patient cannot meet his or her basic needs, is ibig sabihin, they can't give the yung mga hindi basic, diba? So, pag sa wholly compensatory naman, lahat, like, especially the basic needs, the eating, bathing, moving, and giving, ayon sa wholly compensatory, lahat, buong-buo. Next is partially compensatory. The patient can do some self-care but still need help. Both the nurse and patient share care. Sa partially compensatory system naman is si patient, meron na siyang ability to help his or yung sarili niya. Pero is dahil kahit na-help niya na yung sarili niya, kailangan pa rin nila ng someone to take care on them. And this is sa partially compensatory, there is a cooperation of patient and nurse to meet the holistic way ng isang patient. A patient with broken leg can eat and drink but needs bathing or walking, diba? Unlike kay wholly compensatory, si nurse lahat ang gumagawa. Pero sa partially naman, meron ng part or meron ng ability si patient na tulungan ang kanyang sarili. But still, kailangan niya pa rin si nurse. Sa supportive educative system naman, this is the patient can do tasks but needs teaching or guidance. Ibig sabihin, ito muna, a pregnant woman learning about prenatal care or newly diagnosed diabetic learning how to manage their condition. Sa supportive educative system naman, nagkakaroon tayo ng teaching or guidance or counseling. Ibig sabihin, ang binibigyan natin ditong alaga is from the knowledge, from the education. Ibig sabihin, you're giving a take care in a ways of guiding or teaching them ay ng supportive educative system. But in summary, in all systems, the nurse goal is to help the patient meet self-care needs safely, improve their health, and teach them skills they may need. Next is theory of dependent care. Theory of dependent care, we have nursing operation or diagnostic operation. The nurse builds trusting relationship with the patient. That's the first one. Second is the nurse check the patient's abilities, limitation, and needs for self-care. They identify universal developmental and health division requisites. Sa diagnostic operation naman, ang nakapaloob dito is the universal developmental and health divisional requisite needs. The nurse determine if the patient has existing or potential self-care deficit. Ibig sabihin si nurse, tinitingnan na rito if meron bang ability si patient na hindi niya ma-meet yung mga needs niya. Or what are the things that the patient can hindrance para tulungan yung sarili niya. The nurse shares finding with the patient and family. Meron ng operation. Ibig sabihin, there is an assessing needs. Nag-a-assess ka na ng needs dito. Not only dun sa buong kalagayan ng patient, but also meron ka na rin cooperation with the family of the patient. Next, we have prescriptive. Itong si prescriptive is a planning care. The nurse calculates the ideal self-care the patient should perform. Plan self-care action, like what I said, sa prescriptive, nagkakaroon na siya ng planning care. Pero sa diagnostic, inaalam niya pa lang yung mga things that may hindrance the self-care of the patient. Pero sa prescriptive operation, nung nalaman na ni nurse from diagnostic operation yung mga things na it can be served as a hindrance to sa self-care ng patient, sa prescriptive operation naman, binibigay niya na yung plan. There is a planning na sa prescriptive operation. And the planning composed of essential for life, prevents harm, maintains, promote health, improves well-being. And yung planned self-care dapat ni nurse is ma-meet yung apat na to. Essential for life, prevents harm, maintains or promote health, improves well-being. Prescribe who does what the patient does, what the nurse does, and what the patient should avoid. Guides patient to develop self-care skills over time. Tandaan nyo, prescribe who does what the patient does, what the nurse does, and what the patient should avoid. Regulatory naman tayo is regulatory operation is designs a nursing system that regulates and support self-care. Ito naman sa regulatory, carrying out the care. Schedule actions, coordinate nurse-patient collaboration, and ensures time is appropriate. Helps the patient perform self-care or does it for them if needed. Teaches, supports, and motivates the patient to exercise self-care agency. Ensures the patient is learning and applying self-care safely and effectively. Sa regulatory naman, ito na yung pagmamonitor. Nagkakaroon ka na ng regulatory. Yung nurse, example is, yung nurse schedules when there are some changes in pain meds. Ibig sabihin, nagkakaroon na ng outlook of care. Outlook of care na lang yung binibigay ni nurse dito. Pupunta na lang si patient kay nurse if kailangan na ng ganito ganyan, kailangan ng palitan yung dressing ng wounds, kailangan niya ng pain meds, ganun. Sa control operation naman, this is the evaluating care. Example ng evaluating care is, for example, nurse check if wound healing is progressing and adjust care plan if infection signs appear. Sa control operation naman, nagkakaroon na ng observes and evaluation. Just like I said kanina, sa control, ang tatandaan nyo lang dyan, evaluating care. For all of the plans that the nurse give to the patient, sa control operation, tinitignan niya na o ina-evaluate niya na, ino-observe niya na yung binigay niyang agarang tulong or agarang care. And if the plan is if nagkaroon ng sudden unexpected event dun sa progress ng pag-heal niya ng patient is magkakaroon ng adjusting the nursing plan if needed. It confirms that the patient is adapting to changes in self-care ability and achieving developmental goals. Next, theory of dependent care, we have person. Person is the one who a whole person with needs that can be universal, developmental, health-related, and needs caused by illness. Sa person naman, it's a whole being with universal, developmental, and health-related needs. People want to care for themselves, but sometimes they can't meet all of the self-care needs due to illness, injury, or limitations. A person becomes the focus of nursing when their self-care abilities are not enough to meet their needs. Environment includes everything around the person that affects their health and self-care, like family, home, hospital, and social conditions. It includes the developmental conditions like age, growth, or life stage. Nurses consider the environment to support self-care and recovery. Sa environment naman, surroundings that affect the self-care. Example is a child with pneumonia recovers faster in a clean, supportive home environment versus sa polluted, crowded area. And diba, makikita niyo yung difference ng recovery progress ng isang patient dun sa environment na pa lang. Third, we have health. Sa health naman, the concept is holistic. Physical, mental, social well-being. The whole and functional, physical, mental, and socially. Health means a person can meet most of their self-care needs. When health is compromised, the person may need nursing support to regain or maintain it. Nursing helps the person maintain, restore, or manage health and adapt to illness or disability. Nursing is a helping process that is deliberate and planned. Nurses assess self-care, visit, and design care to meet the patient needs. Nursing actions can be wholly compensatory, partially compensatory, supportive, educative. Nursing focuses on improving patients' well-being. That's our goal. That's our goal as a future nurses. Our goal is improving a patient well-being holistically and helping them to regain or develop self-care abilities. Basic general theory. So basic general theory is human needs care to live. People need constant help, either for themselves or from the environment, or to stay alive and work well. Human needs care to live. Ibig sabihin, no one is an island, diba? Sabi ng taba, no? na kailangan palagi natin ng tulong. Kasi nga, as a person, as a human being, we can't meet all of our needs on our own. Next, we have human can act deliberately. People have the power to do things in purpose, like taking care of themselves or helping others. Example of this is a student chooses to eat vegetables for health. Ibig sabihin, we have the power to do things. We are doing it on a purpose. And nasa atin yun as a people. Human face limits. Sometimes people can do everything for themselves. They have restrictions that stop them from taking care of their needs fully. Ibig sabihin, there is a limitation talaga, no? May mga restriction or mga limitation talaga tayo na hindi natin kaya on our own. That's why nagkakaroon tayo ng face limits. Humans learn and share ways to care. People discover and teach ways to meet needs for themselves and others. A diabetic teaches his child about proper diet. Kunyari, example ng humans learn and share ways to care is yung isang diabetic person doon sa bata, nakita niya na kumakain ng maraming candy. Ngayon sabi ni diabetic, ay wag kang kakain ng candy kasi alagaan mo yung sarili mo kasi it contains a mass amount of sugar. You can have a different disease. One of these is diabetes. Ngayon, nagkakaroon na doon ng share ways to care. Ayun yung gustong sabihin nito. Pwede sa sarili niya and also from the others. But especially from the others. Group helps each other. Families, communities, or groups organize care so that members who can't fully care for themselves get the help they need. Ito sa group helps each other. Ito naman yung love and belongingness. Nagkakaroon dito ng supporting, pinatatas nila yung self-esteem nilang isang tao, yung confidence ng isang tao para mag-regain yung health niya or mag-regain yung lakas niya. Acceptance by the nursing community. Ngayon nga, bakit nga itong self-care deficit theory ni Orem is, bakit until now, sa ilang taon na ang lumipas, ilang dekada na ang lumipas, why is it still we applying it in nursing field? It's because of the nursing acceptance by the nursing community. One of this is, this theory is very popular worldwide, and this theory came from many books. Pinag-aralan na rin to. There's a lot of research papers that prove and presentation use her ideas. Researchers have cited her theory as a part of it over 800 times. Imagine 800 times. Hospitals like those in Germany use it to guide nursing care. Nursing school in the US and other countries teach it to the student. Her main book, Nursing Concept of Practice, has been translated into Spanish, German, and Japanese. Overall, Orem theories shape nursing education, practice, and research all over the world. In conclusion, Orem's self-care deficit theory theory says that the people need to take care of themselves to stay healthy holistically, but sometimes they cannot because they are sick, hurt, or weak. As a future nurses or nurses, step in to help with what the person cannot do, either by doing it for them, helping them, or teaching them how to do it themselves. The nurse watches, talks, checks to make sure the help works, adjusting as needed. The goal is to support the person in becoming as independent and healthy as possible. The goal of self-care deficit nursing theory is when the dependent care or the patient is become an independent, from dependent to independent, healthy as possible. And that's it when we see Orem self-care deficit nursing theory. Thank you for listening and have a great day. Adios.
This is Isha. She broke her leg in an accident and is in the hospital. According to Dorothea Orem, Isha cannot do all her self-care by herself. The nurse's job is to see what Isha can do, what she needs help with, and guide her. First, the nurse checks basic conditioning factors like Isha's age, strength, and mood. She looks at universal needs like eating, drinking, resting, moving safely, and staying clean. She also considers developmental needs like learning to use crutches. Lastly, she checks health deviation needs like managing pain and following doctor's instructions.
Hi Isha, I'm Nurse Angel. Kamusta? How's the pain?
Medyo masakit pa rin po and I feel so nervous na baka mahulog ulit ako.
Don't worry, I'm here to help you while you heal. And I assist you with the things you can do.
Okay.
Now, the nurse uses the 4 operations of Orem's theory. First one is diagnostic operation. Nurse Angel sees what Isha cannot do and finds out her self-care problems like bathing and moving safely. The second one is prescriptive operation. She makes a plan to help Isha, starting with safety, then hygiene, moving, and eventually independence. She tells Isha what she will do. The third one is regulatory operation. Nurse Angel guides and teaches Isha step by step using crutches, eating, and managing pain safely. She watches her and helps if she struggles. The fourth one is control operation. Nurse Anna checks if Isha is improving. If she has trouble, she adjusts the plan to match her own needs and abilities.
First, I'll check what you need help, like bathing and eating. Do you think you can eat by yourself?
Yes po, kaya ko naman po. Pero, yun nga po, nahihirapan lang po ako bumaba.
Okay, let's make plan. And I'll help you sit. And later, mag-practice tayo. Like moving your legs and step by step lang naman.
Okay po.
So ngayon, habang mahina ka pa, i-guide muna kita sa mga paglalakad and sa pagbaba. And then kapag malakas ka na, and kakayaan naman na kitang gawin yung mga gusto mo.
Yes po, pero natatakot pa rin po sa akin.
Don't worry, I'll be right here. And kaya natin ito.
Okay po.
And relax slowly. Okay, good. One step at a time. Okay, you're doing well.
Oh, I can actually move. Nakakagaan naman.
Okay, how do you feel after practicing your leg?
Mas confident po ako ngayon. Then, mas napapractice ko naman po siya dito.
Kaya yung goal natin hanggang sa malagaan mo yung sarili.
Okay po, thank you, Miss.
As Isha heals and learns to take care of herself, she depends less on Nurse Angel. This is the heart of Orem's theory. Nursing helps when patients can care for themselves until they can. Through Orem's theory, we can see the 4 meta-paradigms in action. Person is Isha, a growing human being with needs. Health is healing, feeling well, and learning independence. Nursing is Nurse Angel helping, teaching, and guiding Isha, and in environment is the hospital room, equipment, and support that help healing.